Okay, Miss Luann, are you on?
Yes, ma'am.
Okay, so we're going to go ahead and get started. Thank you for joining us today. The last few months have been challenging, to say the least, as we have all been impacted by COVID-19. We know that our retail, as well as many of our other businesses, has taken a huge hit during this time, and our hearts definitely go out to you. And this webinar has been tailored just for you. To ensure the safety of our community and to help you navigate this new norm, we have created a Smart Restart Davie County guide, which will be shown today and you should see on your screen. This comprehensive guidance includes many of the recommendations developed by Davie County Health and Human Services, along with guidelines from the CDC and other federal, state, and local agencies. This resource will act as a living document, which we will update as this fluid situation changes. The document can be found on our website, the Chamber's website, at daviechamber.com. Again, that's daviechamber.com. Today's session will only be 30 minutes, and we will leave room for you to ask questions and encourage you to do so. Also, this webinar will be recorded and sent to you. I'm thrilled to have with us today the Director of Davie County Health and Human Services, Ms. Suzanne Wright, and Public Health Nurse and Communicable Disease for Davie County, Ms. Luann Angel. I will now pass the torch to Ms. Luann to start the session.
Thank you, Caroline. Thank you for allowing me to participate in the call, and thank you for all your hard work on Smart Restart in Davie guidance. It's a wonderful document to assist businesses in our county. And I want to thank everyone on the call today for your participation, but most thanks, the major thing, my thanks to you, is for the sacrifices that you have made to help protect your families, your employees, your clients, your customers, and the residents of our county. Your sacrifice has been enormous. We appreciate your diligence and your cooperation with executive orders and federal, state, and local guidance in this battle against COVID-19. We know that you are anxious to reopen or expand your business if you have been partially open. We hope today's discussion will be a benefit to you as you prepare to safely get back to business. The pages that Caroline has up on the screen are the first section of the retail, but I do want to reference back to at the beginning of the document, pages 4 through 13. There are important safety recommendations and tips, things about cleaning, things about PPE. It's things that pertain to every type of business, not just retail. The sections on retail are kind of divided in groupings. The first, page 58 and 59, is furniture, clothing, sporting goods, bookstores, and crafts. The next two pages are groceries, gas stations, liquor stores, convenience stores. And the last page in the retail section is jewelry. I would like to ask who on the call fits into which category. It might be helpful to guide our discussions.
This is Paulette, and we do hair care products, makeup, skincare, that kind of thing, as well as occasionally we have jewelry shows in the salon.
Okay, and there is a section on jewelry specifically.
Right.
The middle section that talks about groceries, gas stations, liquor stores, and convenience stores, those establishments have actually remained in operation. So I'm going to touch more on the other sections instead of that one, if that's okay with you, Caroline.
Yes, that's perfect. Thank you.
Okay. In your work as a retail business owner, you're required to have close interaction between your staff and your customers, but not necessarily direct physical contact. And your goal is to do this safely in order to protect your employees and your customers. I want you to think about how you've operated in the past and routine safety measures that you always take that are implemented daily, such as disinfecting and cleaning, having sick policies for your employees. And then you need to think further ahead regarding extra steps to take to protect employees and customers against COVID-19. If you're Business site is a building that has been closed, has been sitting idle during this time. There's some things to try to assure that your building is safe. When buildings are idle and there's a reduction in water usage, there can be an increased risk of growth for Legionella and other waterborne pathogens. So taking steps to assure that your water system and your water source are safe. Replacing HVAC air filters, cleaning, disinfecting existing filters, working on your ventilation system, making sure that's safe, and also just doing a thorough deep cleaning and sanitizing all your areas. When we look at the sections in the playbook, I'm going to do the first one, retail, clothing, sporting goods, bookstores, crafts. As I said, it requires close interaction, but not necessarily direct physical contact. As for both these type of retail businesses and jewelry, it would be important to post signage on your storefront that informs individuals if they have a fever or other symptoms of COVID-19, they shouldn't enter the store. When we first started dealing with COVID-19, the CDC guidance gave us symptoms of fever, cough, shortness of breath, or respiratory distress. That has expanded. We know that some people don't necessarily have those respiratory type symptoms. Other symptoms that may be included are headache, sore throat, myalgias, feeling achy muscles and joints, kind of like when you have the flu. Some people have GI symptoms, nausea, vomiting, and diarrhea. And then others have reported, in addition to symptoms, a loss of their sense of smell or their sense of taste. So it has expanded quite a bit to cover other things. Employees should be encouraged to wear face masks or face coverings or gloves as appropriate, depending on what function they're doing within your business. Employees who have a fever or otherwise symptoms should not be allowed to work. I'm not sure about what the number of your staff are, but having a sick policy and kind of sticking to that, make sure employees are aware of it up front. And some businesses want their patrons to wear masks or face coverings. That's something that you can choose as a private business owner, or you may make that suggestion. Some people will automatically do that because that's what they've been advised or encouraged to do. Either way, you need to plan on being able to provide those for your employees or extras for a customer who comes in and says, I forgot my mask, if you have something for them to use. Face masks can be worn for a long period of time as long as they don't become soiled or wet. I know cloth face coverings tend to become damp or wet just from our breathing. So just, paying attention to that. Also encouraging workers to report any safety or health concerns to you, the employer. A big thing about retail is social distancing, limiting the number of individuals inside the store at a time, one at a time. And that's going to be up to the guidance that we get when we get further information in phase 2 as to the capacity that would be allowed in your setting. It's going to have to do with the size of your establishment and what fire codes would allow. All persons in your store should practice sensible social distancing, at least 6 feet apart, 6 feet from another person. You can use signs and floor markings. If you have a checkout counter, just, marking distance between patrons. I know you've probably seen this already in the grocery store or some of the other stores who have continued to be open. And then avoid displays of your merchandise that lead to crowding. Spread things out so people can distance. Encouraging not only your employees, but your customers to use hand sanitizer in your store. Sanitizing your entrances and exits at least 3 times a day, and having access for your employees to also wash their hands with soap and water. We should wash our hands 20 seconds with soap and water. If not soap and water, then hand sanitizer that's 60% or greater content alcohol is appropriate. And then providing more receptacles for trash, adequate numbers for people to dispose of things without having to leave it around for somebody else to pick up, basically. Thinking about sanitizing incoming stock and merchandise. That is recommended, but it's going to depend on what your merchandise is and what the materials are. There is a section in the beginning of this document that I commented on where they talk about different types of surfaces that COVID-19 will live on and for time frames for those. Things coming in, if it's not urgent, if they can be left idle for 48 hours, that would be beneficial. Sometimes things have to be handled more frequently or sooner, just making sure your employees use gloves and they sanitize the items as they should. Some businesses are doing symptom screening and temperature checks for their employees when they come in on their shift. You're a private business, you can choose to do that either way. As a healthcare worker, I'm accustomed to doing that in the healthcare setting, but a lot of small businesses have implemented that with their staff. And another thing to think about is your contactless transactions. That's a new word for me to put that all together. It's kind of a tongue twister. But what it means is to sanitize your point of sale equipment, including pens, electronic terminals, pen pads after each use. Encourage your customers to not use cash, to make non-cash payments. Protective screens could be used at the discretion of each store, kind of in front of your register. If you have more than one register, they should be 6 feet apart. Salespeople should encourage customers to either insert their payment card or provide their own PIN, sanitize the store's PIN before and after. Receipts should be left on the counter. The less distance or the less contact that you can have, direct contact between your employees and your customers, the safer that would be. Looking ahead to I think it's page 62 of the document, is particularly about jewelry retail. And that allows for more consistent interaction with your customers during your operating hours, because you are handing them jewelry items, they're trying things on and returning them back to you. Disinfecting and sanitation is going to be a big theme. Showroom and common areas should be sanitized before opening and throughout the day at different intervals. Gloves should be worn by employees to transfer all jewelry and equipment, and employees must wash their hands before working and at different times throughout the day, depending on what they've done. Stores can use a combination of equipment that includes a steamer, a boiler, ultraviolet light, alcohol, sanitizer, different means to keep jewelry clean and germ-free, because metals and gemstones have individual characteristics and reactions. The jeweler must be allowed to determine the safest way to clean each item of jewelry. But it must be sanitized at intake, particularly when you receive a shipment in, and sanitize at the point of sale, and then after it's handled, and if it's put back in a safe or put back in a different setting, it should be sanitized at the end of the day as well if it's been handled by patrons or by employees or patrons. Customers, it's not out of the norm for you to ask them to put on gloves if necessary. Trying on rings, you can't do that with gloves, but they should wash their hands before and after, or make hand sanitizer available to them. And a little bit to touch back about people who are sick, because this was covered in the previous section, but just thinking about sick employees and making sure they don't come to work sick, and sick customers don't enter your store. So there is signage, as I said earlier, on the CDC website that helps with that. We are here available at the health department through our COVID call center. Our number is 336-7 888-753-6550. Our call center is manned by nurses Monday through Friday, 8:30 to 5. We are available after hours or on weekends. You call the same number and it rolls over to the nurse on call. So someone would be able to call you back if needed. We're certainly here for a resource. We're glad to take your questions. If it's things we don't know the answer to, we will seek that out. I know as the phases come out, there will be specific guidance for retail, and it's hard for me to speculate what that might be. We tend to have to wait to see what the governor says, basically. But that ends my information session. I would like to ask if you have questions or even ideas that you have in your particular setting that you use or implement to protect your customers and your employees.
Paulette, I'm going to go ahead and pick on you.
Okay, pick on.
So do you have any questions or concerns? Now is a really good time to ask, and I always say there's no stupid questions.
Oh, I realize that. No, you're. If there was one, I'd find it. We have, and for those who may not know, I'm in a beauty salon and I do skincare, but we have a great deal of retail. We do a great deal of retail with shampoos, conditioners, hair care, that kind of thing, as well as skincare and makeup. And, we have to listen to a lot of people. We listen to state board. And then, of course, CDC and the health department and all that everyone else has to listen to as well. We did get rid of all the magazines. That was something state board had encouraged because bacteria can hide in those things. And it occurred to me a few minutes ago when I saw bookstores up at the top of the list. Some of our folks are big readers and they love to bring books in to exchange or leave for other people. It would seem to me we shouldn't do that either. Am I correct?
Yes, ma'am. I would curtail that during this time, definitely.
Okay.
Yeah.
Okay.
We had an earlier session today about salons.
Right.
I know that Caroline's going to be sending out information. There's we touched on hair salons and barbershops. There's also sections on nail salons
Right.
and massage. And we had a person on the previous call that dealt with spa-like activities, facial,
Sure.
and that type thing. So a lot of that was covered, but you're right on the money and following the state as far as magazines and that type of thing. Definitely.
Yeah.
Can I ask you a question as far as
Sure.
your retail space where you have your products? Is it so that people can spread out to shop or so that they can observe and then ask an employee to help them so they're not handling all of your products?
Well, previously the waiting area, which is where the majority of the retail is, not all of it, but the majority of it. Some of it is spread out. There is a section that has one particular company in it that has a whole lot of different things, and it's in a different part of the shop. The skincare, for the most part, is in a different part of the shop. So in that respect, yeah, it is spread out. However, the reception area is long, but it's not very wide. But again, going back to state board's regulations and suggestions, we're just going to ask clients to text us when they get here, and we'll text them when it's time for them to come in. And so therefore people won't be congregating in the waiting area while this is going on.
That is perfect. That was something we touched on earlier, and that's really, really important that you stay in control of how many are in your shop at a time.
Right. And we've, I've actually ordered disposable sheets and that sort of thing. We won't be using linens to the extent that I have, in part because it's going to cut down on volumes of laundry, but in part because that'll be changed as the linens were with every client. But at least this way, we can just put them in a trash bag and feel like it's a little better than them being in a hamper somewhere.
Yes, ma'am.
So yeah, I'll be going to that. I frequently wear gloves when I work, so that's not an unusual thing. The hairdressers sometimes don't wear gloves as often as they're taught to, but I think that we'll see some changes in that as well. I know that's something that we're working towards.
Good deal. Miss Luann, I do have a couple of questions that came in because people weren't able to join in on the conversation. One of the questions was furniture stores. You go into furniture stores, we like to sit on the couches and in the chairs, and we like to touch it and feel it and all that kind of stuff, right? What is your recommendation to our furniture stores? And we have a few in the county.
That's a good question. And I'll be honest that I don't have a definite answer, but certainly we'll check into that. It's not one that we've had some specific guidance from CDC or from the state, but just thinking about contact surface, common contact surfaces, no matter what they are, in any type of business, needs to be able to be cleaned or be protected. If they're selling bedding and people are trying that out, then they need to use the paper sheets over it so they're not laying on the bedding where somebody else is going to lay down on the bedding as well. Some furniture stores do a really good job of that. As far as other furniture being able to clean, I know wood furniture furnishings may not be as easy to disinfect as others. The guidance on types of products and how long it stays on there, I'm not sure that it gives enough about specific cleaning products for those surfaces. It just talks about how long the virus would live on those surfaces. And on wood, it's 4 days.
Right.
And that includes furniture. Examples were furniture and decking.
Got
So
it.
that's something I would like to research a little further and get back in touch with you, Caroline, so that information would be made available.
Perfect.
Okay.
My next question was in regards to masks. A few of our retailers have asked, do they have to provide masks to customers, or is it personal responsibility?
Initially, it's personal responsibility, and certainly to provide them to their employees, and they can suggest to their customers. Would be appreciated if they were use a mask or a face covering, but they do not have to provide those. Certainly, in thinking back to the salon setting, your client comes in, it's your stylist and your client face to face. They both should be wearing a mask. Your client gets there, goes, "Oh, I forgot my mask." It would be helpful if that type of setting that you would be able to provide that to. But as larger retail stores with less direct face-to-face contact, they're not required to provide those. They could suggest that their customers wear them, but they really should provide them to their employees, but not necessarily to the customers.
Okay, great. And then my last question is in regards to shopping, trying on clothes. Is that allowed? Do the retailers hold any responsibility in that regard for people being able to try on clothes and all that kind of stuff?
There again, that's another one that there's not specific guidance on, because these establishments have been just closed, and I don't think there's been a lot put out about that.
Okay.
But that clothing, furniture, definitely I will look into.
Okay. Well, those were my questions. So I think that's everything. Paulette, do you have any other questions?
Just one quick one about the fire marshal and the occupancy, the executive orders for occupancy from the fire department. Do we know if Davie County actually sends somebody out, or do they have to give you that, or do they have the software on the computers that you can give them your address and they can do, I think it's Google Earth that does it, that tells you the size of the business and what your capacity is. Do we know what we do here?
We would have to confer or get information from the fire marshal regarding that.
Yeah.
I know when the orders come out from the governor, they will say, they'll word it as a certain percentage of your occupancy capacity.
25%, I believe, generally, but you know, you need your square footage to get your
to know
occupancy.
Yes.
And I know roofers have that software, so they don't have to come out and tell you how many square feet, you know, it's going to take to roof your house. So I was hoping maybe the fire marshal had that same sort of technology, so you didn't have to wait for them to physically come out.
Is it you're building an established building here in Davie County?
Yes.
Okay. Our environmental health may be an option to determine that. Definitely the fire marshal's office, or if you go on our website to the GIS mapping section, there may be. I'm not certain, to be honest.
Okay, so the GIS on the health department's website?
Actually,
Davie Health?
Davie County webpage, daviecountync.gov, and there's a button, a little circle tab that you can click on, and it's GIS, and you can actually go to any map of any property in Davie County. Now, as to what information is available for structures on properties, I'm not sure.
Well, it'll be worth a shot to look at.
Yes, yes.
Well, I appreciate all your help. Thank you.
Thank you. And that was a great question, Paulette. And we'll look at that too, and figure out if there's just a one-stop shop for that answer, right? Because that would be fantastic to know. Well,
and it would be quick if the fire department had it for a lot of businesses, you know.
Well, thank you so much. And I hope, again, that this webinar has been beneficial. We know that we all want to return to our lives like it was, you know, prior to COVID. But thank you for taking the necessary precautions during this time. If you have additional questions, please reach out to Davie County Health and Human Services or the Chamber. We'll be glad to assist you in any way we can. And as always, Luann, you know, I've got to ask, if businesses are wanting you to maybe do a Zoom call with them to go into their place of business to make sure that they're doing things correctly, are you guys willing and able to do that?
Yes, ma'am, most certainly.
Awesome. Great. All right. Well, this ends this session, and thank you so much. And I hope you guys have a wonderful rest of your afternoon.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Okay, what's happening?